okay, the session.
Can I also say something?
Yeah.
Why is it that when we finish lecture, I in particular request for recording, I don't get it? Because if I don't get the recording, I can do my assignment. I'm a staff carer and a night staff. So practically, I come from work, then I sit here to follow this Zoom. I'm half asleep, and later I'm supposed to have the recording to go through to know how to do my assignment.
Yeah, I totally understand that. Can you just email or text in the group?
I've tried. I've all the email they put in, no one is working. Even I try to email the email they send me. When I try to open it, it tells me that it is not working. So I don't know. Or it's me that I'm doing it wrong, or something is wrong somewhere.
What you can do is, can you tell me your name, please? I can.
I'm Josephine Harrison.
Okay, Josephine. Okay, that's fine. Josephine, I will let them know about this. They'll get in touch with you.
The only recording I have is the first IT, first and second IT section that we did. The others, there is no recording. Even the learning, the writing, I don't have it. So I don't know how they expect me to do my assignment.
Yeah, that's okay. I'll let them know. And if you could just drop a text again in the group, and then I'll try and follow that up. Is that okay?
All right.
Yeah. Okay. So we'll start with the session. Yeah. Does anyone have to say something? Okay. So some key terminologies here. So what's necessary for working as a healthcare professional? No set in entry requirements, obviously, to become a healthcare support worker, but you should have good literacy, some numbering skills here and there, that's expected. And sometimes you should have your GCSEs or an equivalent of those. Sorry? So that's required in some places for English and maths. But there's some other health qualifications such as BTech or NVQ for some of your roles. So it depends upon what role you're applying for. So you might not require anything. There might not be any set requirements for being a healthcare support worker. But then again, it depends upon which area you're working in, and if you've to, for instance, if it's something to do with people coming from multiple ethnicities, so you might have to have linguistic capabilities also. So it's different for different organizations. So to be a care worker in the UK, you would have to have a qualified. So if you've to qualify for a health and care worker visa, you must be a qualified doctor, a nurse, healthcare professional, or adult social care professional. So, and you might have to be working in an eligible health or social care job, work for a UK employer that's been approved by the Home Office. So there's some requirements that you have to have in place, without which it's hard to get into as a health and care worker. So there's some policies and legislations that impact on healthcare. We've talked a bit about them. So the major policies, so we talked about the devolution of healthcare, the integration of health and social care, principle of choice in healthcare. So we've talked a bit, not a bit, we've talked quite in detail about this. So this was the structure yesterday, which we discussed in detail, of health and the social care system in the UK. So some of the major legislations that we would talk about today would include Health and Safety at Work Act, 1974, and other health and safety legislations, Mental Health Act, 1983, Human Rights Act, 1998, Data Protection. Just a minute. Just give me a minute here. Yeah, so Data Protection Act and Mental Capacity Act, which was founded in 2005, Health and Social Care Act, 2008, Equality Act, 2010, Health and Social Care Act, 2012, and Care Act in 2014. These are the major legislations that affect the delivery of healthcare. So there's some in the health and social care sector, which include Care Quality Commission, which was founded in 2009. NICE guidelines, we've talked about them yesterday, which were founded in 1999, and they have their regular updates and their updates in their regulations and their guidelines. Then you have Public Health England, which was founded in 2013, UK Health Security Agency, UKHSA, founded in 2021. The King's Fund, 1897, we talk a lot about that, and the Medicine and Healthcare Products Regulatory Agency, which was which regulates mostly medicine and healthcare products. Let's do an activity here. So when we are focusing on the NHS and different healthcare provider roles, there are different people who can have different roles that they could do. So if I just click this, so there are 350 different NHS careers, and everyone makes a difference every day. So let's see, finding how could you find your career. So let's say anyone here would like to click on something. Would you want me to click on something? Anyone? Something that's a majority between you guys? Can you see my screen?
Yes, please.
Yes.
So anyone, if you could just, should we do healthcare support workers? Okay. So you have different roles over here as a healthcare support worker. So let's say anyone would want to be a healthcare assistant, or I would want to be a healthcare assistant. So if I click on this, so you have a whole detail of what a healthcare assistant does, what are their requirements, how's their work life. So, and they talk about different cases that have been there. They talk about your entry skills. So you might have to follow these entry skills, and your training and development, pay and benefits. Your vacancies are mentioned over here. So this gives you a good overview of what you want to do. And let's say you want to explore any role in the healthcare system. This gives you a good overview of what would your entry requirements, what would they be, and how would your life be as a healthcare assistant. So you have several jobs over here. There's several opportunities that could be explored over here. So I'll just stop sharing this. This is something worthwhile if you could just have a look at it. And I'll share the link with you actually. Start sharing the presentation again. And so just okay. So here, if I see the link, just share the link with you. So this is for the healthcare assistant. You can go into this link and have a look at the others as well. I'm putting this up in the chat box. This is something good that every one of us would want to see, actually. So I'll start sharing my screen again. Yeah, that's about it. And then if we proceed with the lecture, yeah, just put this on the screen. Okay. So, identify two, let's say, of two of the requirements necessary for a healthcare professional in terms of values, or you could have attitudes, you could have skills, ethics, and compare and contrast the merits of each. So if you could just look at that link, and if you could identify any two of the requirements necessary for a healthcare professional, or just think of it, any two requirements for a healthcare professional in terms of values, attitudes, skills, knowledge, ethics. Can anyone comment on this? Any two requirements necessary for a healthcare professional?
It should be passionate.
Mm-hmm.
It should be passionate and what is the other one? Empathy.
Yes.
It should empathize.
Mm-hmm.
To give a person-centered care.
Mm-hmm. So that's that's necessary for a healthcare professional, yes?
Yeah.
So that could come under your values. So you can, yeah, and then you can compare and contrast the merits of each of these. So why is values more important, or why do you say, some people might say values are more important compared to attitudes. If you don't agree with that, you could say all of these are important, and obviously you should have the skills, the values and attitudes, knowledge and ethics, but some of them might be more important than the others. And if you have all of them, then that is great. Obviously, that's the real goal. So two important requirements for a healthcare professional: their skills and ethics. So what do I mean by skills? That you should be having the skill set for what job you've applied for. So if it's in the healthcare, and let's say you want to be a phlebotomist, so you should have appropriate skills for that, because we won't, obviously, you can't risk anyone's life, or especially being a phlebotomist. Or let's say you are a healthcare professional and you want to go into just, let's say, any example, let's say a wound care, or let's say you want to go into the Department of Anesthesiology and support there. So you'll have to have some basic skills there that are necessary, without which obviously you wouldn't have a better understanding of the system. So what are the skills? So healthcare professionals, when you talk about practical applications, they require a wide range of skills. These include clinical skills. So you would have to perform physical examinations, administering medication. So you might not have to administer medication, but if you have that skill, that's added on to your achievements. And performing surgical procedures. So you might not have to have that. I don't have those, the training to perform surgical procedures. I had it when I was doing my medicine, but not now. Obviously, I'm not updated. But if I want to go into that system, I would have to have the proper skills then again. And then communication skills like empathy, you just mentioned it, that's so important. So with everything, even if you have the skills, you don't have empathy, that's not going to work then. So you have to have this power of listening, explaining complex medical information, not using jargons. Obviously, we are not going to use jargons at all. We are going to use very simple language, simple to understand, building rapport with the patients. And these skills are critical when you want to provide effective and safe patient care. Then you have continuous improvement. So continuous professional development or continuous improvement. As I said, skills, learning skills, it's an ongoing process. So like when I joined the university as a teacher, as a lecturer over here, I thought of improving my skills and work as a first aider. So I did that first aider course. So that was I'm not at the forefront of performing first aid there, but at least if there's a need there, because I'm dealing with students, I am then able to provide my expertise there and my support there. So I guess it's something that you should be aware of, that these options are there, and if they're relevant in your field of training. Like let's say if you're a first aider, you can be your skills or your what you're doing, that this kind of whatever services you've to offer, they could be offered in any setup. So and it's another feather in your cap. So it's adding to your CV, it's improving your status, it's securing your place. So you never know when you need this job, this new job that requires you to have your first aid training completed. So these bits and bobs, you could maybe add them to your training. It doesn't take much time, but it's always good to be in this mindset that you improve yourself continuously. So the new techniques, technologies, treatments that emerge, healthcare professionals must stay up to date and adapt their skills accordingly. So this ensures that patients receive the best possible care based on the latest advancement and practices. So if I ask you all, is there one specific training that you think you could want to have as a healthcare support worker, whatever you're doing, and what if you had that, how would it advantage you? Can anyone of you comment on this?
How would it work? Come again?
So yeah, so if you want to develop your skills in anything, let's say you want to be you're aspiring for this job, or you are in this job and you want to achieve a new skill. We're talking about continuous improvement or continuous professional development. So what would that one skill be if you want to improve yourself? How would that one skill support?
For one, at present, I'm a carer, so I want to be a nurse, so I'm doing nurses. I'm trying to improve myself.
Mm-hmm. Brilliant. Yeah.
So
what would you, yeah.
You have to update yourself. You have to keep updating yourself with the new practice, that because day in and day out there are new practice and new updates that, and they always introduce some things that used to be acceptable in the healthcare sector. It got to a point, some of them are not acceptable. You can't do it anymore. So you have to keep updating yourself each day. Like you have to always be updated and know how to equip your skill to the standard of what is appropriate at each time.
Mm-hmm. Yes.
you know, something like e-learning.
Yes. How would e-learning support you?
Pardon?
How would e-learning support you in your wherever you're doing or whatever?
It helps you improve yourself, like the latest or like policies that are put in place, how to care, what to do, how to treat or how to talk to patients, something like that, I think.
Yeah, so you have different e-learning. Some of them are completely free. So you can always register yourself for these e-learnings sessions just to improve your skills. And then it's for your own development. So if you have them, it's always going to. It's never that learning never kills you. So it's always, you're always at an advantage when you're learning professionally. So thank you for the input. So ethics now, the second part is ethics. If anyone else wants to add, you can always add to the chat. You want to add something to the discussion that's going on right now? Yeah. So for ethics, there's an importance of trust, integrity, and professionalism. So when trust and integrity, the ethical behavior, it's essential for establishing between healthcare professionals and their patients. So your patients, they trust you because of your integrity. So this would include maintaining the patient's confidentiality, obtaining the informed consent. So whenever you're doing any process, any procedure with them, you're taking a history from them, or anything, even bringing them for an examination or going for a procedure, just ask them for their consent, which is very important. And making decisions which prioritize the patient's best interests. So you're going to make the patient's decisions based on their plans, their aspirations, their feasibility. So that makes it patient-centered. And also, it should be in the patient's best interest. So whenever you encounter such instances where the patient's best interest is being jeopardized, you should then intervene. Trust and integrity they're vital for fostering strong and lasting relationships between patients and providers. And this would obviously lead to better health outcomes. And that's all that you want, isn't it? And then comes professionalism. So you have your code of ethics, and you have a commitment to maintaining high standards of practice throughout your career. So when you're following ethical guidelines, healthcare professionals like you should avoid potential conflicts of interest and ensure that equitable treatment for all, including all patients. So it should be inclusivity. Include them in your communications, include them in your treatment, in whatever you are doing, in the plans that you're making. Maintain public confidence. This improves the confidence of the public in your profession. So, and this is very vital because this confidence, then if it's maintained and it's in place, that then saves you from a lot of difficulties in the future. So, person-centered values. So we'll talk about this in detail. So there are two other requirements for a healthcare professional, such as values and knowledge. So this is important, obviously, if you want, and these require, if you have your values in your case and you have knowledge also, obviously, your continuous professional development will enhance your knowledge. And when you understand the importance of each requirement, this highlights your significance as a healthcare professional. So the person-centered values, if we consider them, there are 8 basically. So one of them is compassion and empathy. So that as a healthcare professional, you should have a strong sense of compassion, empathy for patients. This will help the people or your patients understand and address, you will understand and address the emotional and psychological need of your patient. So if you have a compassionate outlook towards your patients, throughout your career and throughout your practice, that is going to then improve the patient's communication with you, and they'll be expressing their needs more often to you. And this will lead to patient satisfaction and improved health outcomes, obviously, from the physical point of view, but also from the mental health point of view. Respect their autonomy, which is very important. So you should value patient autonomy, which means that you need to respect their right to make informed decisions about their own health care. They're autonomous in some aspects when they're deciding their own plans or their medications, let's say. Obviously, you will have the a higher say in that. Whatever should happen in the patient's best interest. So if they're let's say they're not comfortable with taking a tablet, you could probably ask them if they could take a syrup or vice versa. Anything that helps support them in a better way. So providing patients with the necessary information, support to make choices that align with their professional values and preferences. So you need to know, let them know how autonomous are they, on which aspects are they autonomous, and how could they use that autonomy in a positive way. And that should be obviously to support them in the best possible way. Talking about knowledge, so when you talk about knowledge, you should have some medical expertise when you're working as a healthcare professional. So you might not have all of them, but some of them are your basics. So you must possess a strong foundation of medical knowledge. So this includes an understanding of anatomy, physiology of the body, the pathologies that are there within the system, pharmacology, obviously to combat these pathological conditions, to prevent from them, and other relevant subjects wherever. So if let's say there's nursing, so you should have a nursing background, the subjects that are involved in that. This knowledge is crucial for helping you in making an accurate diagnosis, provide effective treatment if you're a part of the treatment plans, and manage various health conditions in an appropriate way. So that's there. That should be as a stepping stone, as a basic foundation for you. And then there's evidence-based practice. So this will be continuing lifelong. So you'll always have to refer to evidence-based practices, which will show you what are the best current practices, and they'll give you the evidence-based guidelines in your respective fields. And you'll be able to provide care that is backed up with latest research, and it has been proven to be effective. Instead of just giving a trial to someone, you know that this medication has its own benefits, or this sort of treatment strategy has its own benefits, and they've been proven through literature or through evidence. So this will also lead to patients having better outcomes or healthcare quality. So the 6 C's of healthcare, which are very important. So these are the values that are essential to compassionate care. So you have care. It is our core business, and within our organizations, it is there, and the care that we deliver helps the individual person and improves the health and the well-being of the whole community or the whole society. So obviously, caring should be a part of the healthcare system, and it should be consistently the same throughout every stage of the patient's lives, regardless of their backgrounds, wherever they come from. And then you have compassion. It's how care is given through relationships based on empathy, respect, and dignity. It can also be described as intelligent kindness, and is central to how people perceive their care. Competence is very important. So it means all those in caring roles must have the ability to understand an individual's health and social needs. That comes to a better competence. And it also has to have an expertise clinical and technical knowledge to deliver effective care and treatments that are based on research and evidence that improves your competency. And then communication, which is central to all relationships, particularly when it's concerning the patient and yourself. So listening is very important in the communication chain, and it is essential for no decision without me being communicated to the patients at the first end. So it's the key to good workplace with benefits for those in our care and staff alike. And courage. So when you're courageous, it helps you to take the right decisions for people, to speak up for them. And you have this personal strength and vision to innovate and to embrace new ways of working. And then your commitment is very important. So you're committed to caring for the patients, for showing compassion towards the patients. And you need to build on your commitment to improve the care and expertise of patients. And it is important to take action to make this vision and strategy a reality for all and meet the health and social care challenges ahead. This is from the NHS England. So the skills and ethics that are all vital for a healthcare professional, and these skills enable a healthcare professional to perform their job efficiently, effectively, and provide the highest quality care to their patients. And ethics ensures that your actions and decisions are grounded within the moral principles. And this also promotes trust, integrity, and professionalism. So in summary, you have your values and you have the knowledge that is essential as a requirement for being a healthcare professional. So these values guide the way you approach your patient care and interact with patients. So promoting compassion, empathy, and respect for autonomy. Knowledge is very important. So it forms the basis, as I said, for your medical expertise. So it's to deliver high quality evidence-based care to your patients. So you have to have some basic knowledge that is there based on what expertise you have. And then you have continuous professional development or evidence-based practice that needs to be enhanced on a regular basis in order to provide the best possible care, and that is also backed by research. So these are essential components for a well-grounded healthcare professional who is dedicated to provide excellent patient care. So here, there's a reflective practice. So whenever we talk about these action verbs, so describing the importance of reflective practice for healthcare professionals, you should, it implies mostly what you're to do in your assignments. So reflection, it can have a positive impact for your service users, your colleagues, your practice, and your health and well-being. So reflection actually allows one to identify and appreciate what happened positive whilst you are doing anything, and identify ways you can improve your practice and service delivery. And it's also useful when you have had more challenging experiences, and this helps you to process and learn from your experiences. So their employees, we all can have reflection. So it's not just the healthcare workers or the staff members, the employers, they could have the reflective practice also, which helps a lot in the longer run. So employers and managers will also be able to see the benefits when their staff take part in reflective practice. So professionals who are able to reflect, protect their mental health, and share together, they can make stronger and cohesive teams. So employers and managers are also likely to see positive impacts where professionals have a space to discuss best practice and how to learn things, and how to learn if things could have been better, or how to do things in a different way. I'm sharing this video with you. Before that, I'll just go through this Gibbs reflect cycle. So after this video, I will appreciate your input on if you've had some reflective practice and how it's impacted you in anything that you've done. So I use reflective practice according to Gibbs reflective cycle. This was a researcher. So I'll just start my annotations. So here, so a reflective practice, it's increasingly being considered in professional development as a critical dimension for health professionals, and professional standards and credentialing processes demonstrate continuing competency for most health professionals. They now require demonstrations of reflection or reflective practice. So what has happened? What happens in it? So let's say it starts with description of what happened. So let's say you will give your examples here. I will ask you, some of you, to share your examples of having a reflective. We feel that we might not have had it. Sometimes when you look deeper inside, you should appreciate that you've done some reflection sometimes. So what happened? Let's say a patient, you went for, they came for a phlebotomy test, or came for an X-ray test, let's say, and they had a long wait, let's say, and they collapsed, or their sugar levels got down, or let's say anything happened. What were your feelings and thinking? So describing the situation, what were your feelings? What were you thinking at that time? You step back and then you realize what you felt at that time. Then you evaluate what was good and bad about that experience. Good and bad about that experience regarding you, obviously. Obviously, if it's the patient who's being impacted, you would have had not a good feeling about it. So that feeling, that experience was not good. So you'll evaluate that, and then you'll analyze. So what sense can you make of the situation? You'll analyze what happened. Why did it happen? What were the circumstances that led to that incident, or what happened, that incident that happened, any incident? And then you'll draw a conclusion. What else could have you have done? So when you're reflecting, you're actually seeing through a different lens, and you're realizing that, oh, this happened, but this should not have happened, and what could you have done? Regardless of whether you have done it or not, you still could have done better. We believe that there's always room for doing better. So your action plan will be that if it arose again, what would you do? So you should have a good reflective account of all of the situations that happened, especially the ones that are more crucial in your life, in your work as a healthcare worker. So if you have this practice, it improves your actions that you would take in the future. So if I just share this YouTube video with you, and then after this, I'll appreciate if you could give me any example of when you've had to be, just a minute. Okay, so I'll share my screen with you. Please let me know if sound is there.
As a clinician, that's one of the most important things. I think as a clinician, that's one of the most important.
Can you hear the sound?
Yeah.
Thank you. Okay, so here you go.
Things that you can do is reflection. Reflection on practice, reflection on how you are as a person.
You can just keep on ploughing on every day. You won't ever improve your clinical practice if you don't reflect back on it.
Mistakes do happen. Human errors are always going to be there.
But the only way to minimise that is to reflect on the things that have gone wrong, not necessarily just for you, but for your colleagues.
As soon as you start to reflect on it, you can see that something you thought of as just a normal day or a small occurrence is actually a really good example of maintaining a CPD standard.
And we're constantly doing that. We're constantly looking at things that may have gone wrong or that might possibly go wrong, and trying to learn from them.
Everybody reflects differently, but I reflect inwardly and sort of think, how might I have done that better? Did I approach that in the right way?
Whether it's reflecting self-reflection or reflecting, discussing with my colleagues and peers, that's the way I'll learn and develop.
You can read something, you can have a chat with somebody, you can have a situation where you've reflected on.
And having that ability strengthens your awareness of yourself and actually makes you a more proficient practitioner.
You can grasp more the things that you do well and the things that you're still kind of working to figure out.
Through that, you will become the best you can be.
Ultimately, it's important because any member of the public can know that their health professionals will have, these qualities.
Okay, so that's about it. That's about the presentation. I'll just start sharing my screen again just to notify. Oh, sorry, this one. Yeah, this one is it. Okay, any comments on this? Has anyone gone through the reflective process? Have you ever practiced it? Or if you think you practice it, how would you do that? Anyone? So, okay, I think that will be a part of your assignment actually. So if you're not comfortable or you've never done it before, so you would be doing it definitely. So just remember this Gibbs reflective cycle. If you've never done a reflective account for yourself or during your practice, this is a very good way of and it doesn't have to have a very big exercise. It's just like reflecting back on whatever happened. So if you start off with smaller things on a regular basis, you can do it for larger pieces of things also and larger aspects within your practice also. So it always helps, at least it's always helped me. And it gives me good evidence of what has happened before. So if I've documented it and I have my reflective accounts, it's just a thing about being conscious about what I'm doing and being aware of what other possibilities are there in order to do things in a better way. So on that note, I will stop sharing this presentation. Any questions? Any questions from anyone? No?
Yes. It's not about it's about what you said about the first aider. You said you've been trained for the first aider, right?
Mm-hmm. Yeah.
I want to know, as a carer, can you also do the first aider training at uni? Is it a professional job as well?
Yes, so I know of a person who is working as a first aider. So he's been trained as a first aider. So yeah, you can have a job as a first aider, and it's a very good job. And even if you don't have it, there's some jobs that require you to be a first aider. So it's always beneficial to have that training anyways.
Oh, so do we do it online or you need to go to the uni?
No, you would have to go there because it's a whole process of giving BLS, basic life support, and sometimes it's advanced support also. Yeah, so you'll have to actually do it. So there are many organizations that support this, and you could find one that is recognized in the UK, and then yeah, it's always beneficial. Apart from this was just an example that I'm giving from my side, because
Yeah,
I
I
deal with,
understand.
yeah, I deal with students, but you can always have it because you're in the healthcare. You would need it even more.
Yeah,
So that's
yeah, that's what I'm asking.
Yeah.
Okay, then thank you very much.
You're welcome. Any other question? Okay, that's it from my side. So the next week, we're hoping to have a session based on your assignment. So I am hoping that all of you could be be able to attend it. And if there are no questions, then I'll end my presentation here. Thank you so much for joining today, and take care. Have a lovely day and a lovely week.
Thank you too.
Thank you. Bye. Take care. Bye.